they'll be up to speed as well. I am so excited to chat about how to lean out the midsection through VIP this month, but we're not simply going to be chatting about core circuits and calorie deficits and drinking a little bit less alcohol or maintaining a calorie deficit with less chips. This summer, we're going to be getting to the root cause of why you might be bloated, why your midsection, fat might not be shedding off, why you might be presenting symptoms of diastasis recti. We're going to be doing a training later this month with Linda Lippin, who is an expert in all things DR. Today, we have the gorgeous Kendra on the call with us. Kendra is a nurse practitioner. She's also someone who has her doctorate. And Kendra, can you introduce yourself to our group? Even maybe tell them just briefly about your experience in the Faster Way to Fat Loss so that we can hear from you on that as well.
Sure. I'm Kendra Kratzwald. I live in Lexington, Kentucky. I've been a nurse practitioner for about 4 years. I've been in the GI and hepatology space for that long as well. I have been a healthy person, exercised, dieted, weight trained, done it all. Came across the Faster Way to Fat Loss from Beth Chapo, who's also previously lived in Lexington and is just amazing. I love following her. And I did 2 full rounds of the Faster Way to Fat Loss with ridiculous results, better results than I'd ever seen before, and just improved general health as well. And then now I'm part of the VIP group and just keep trucking along. And I've had many friends and families and patients also join the group as well.
Yay! And I love Kendra because she literally was on Instagram with a megaphone telling people to join the, like literally a megaphone. And I was like, you are my favorite person in the whole wide world. Kendra is the type where she believes in something, she's going to shout it from the rooftops and even amplify that with a megaphone. For me, that was really awesome. Also, Kendra is such a smarty pants. And so even this week when I was having like some issues with like this weird rash on my midsection and all that, I'm like, Kendra, do you know what's going on here? Like, what can I do? So again, we're going to chat about gut health today because here's the deal. We all want to lean out our midsection. Is there anyone on this call who isn't like, there's a little bit that I could do to lean out the midsection, get rid of some fat, whatever the case may be. But what many of us don't realize is that we have bloating or we have inflammation because we have a compromised gut. We have compromised gut health. So Kendra, tell us a little bit about why gut health is so important.
Well, this is definitely my passion. It's what I do for a living. And I, like you were saying, when I get passionate about something, I get probably too wordy. So I'm going to try to keep it simple. I don't want to overwhelm people, but your gut is your powerhouse. Your gut is where over 70% of your body's immunity is generated and created. It's where micro and macronutrients are absorbed and metabolized for energy and for muscle development and bone development, and teeth and hair and all those things. It's our tank. We're all engines, and the gut is your tank and your fuel source. And if it's not running well, nothing else is going to function well. And so there's so much that can be affected, not only just with your physical symptoms, but also emotional, psychological, your cognition. I can't tell you the variety of symptoms that I've seen from patients who have a compromised gut. And it can be anything from hair loss to severe depression. I've seen it all. And just also your perception of self and your perception of, hey, I'm an adult woman who had an accident today at Meijer and I pooped my pants. Things that can really affect your self-esteem as a person. The gut just really plays a huge role with all of that. So yeah, it's my passion for sure.
Absolutely. Tell us a little bit about how and why gut health can be compromised, because I think many of us are doing things that are negatively impacting our gut, and we just have never thought about that connection of like, oh my gosh, I'm just sitting in my chlorine pool every day for an hour for the past 3 months, and now I feel like I have compromised. Like, tell us a little bit about what causes compromised gut health.
Well, we live in an environment that is bombarded by antibiotics, by antifungals, by antimicrobials like chlorine. We live in this world that is obsessed with cleanliness. And there's a lot of studies that show that, in less developed countries, there's actually less illness in a lot of cases because we really over antibiotic, we over treat, we over clean. And so we develop a lot of resistance to, to different types of illnesses that we may otherwise have resistance to. So there's a lot of reasons why somebody can have a compromised gut health. A lot of it has to do with exposure to antibiotics. We eat food that's been treated by antibiotics. We're exposed to antibiotic soaps. We are treated with numerous antibiotics as children. And so our natural gut microbiome, or the millions of organisms that live in our gut, naturally that God placed there, become compromised because of the constant bombardment of antimicrobials that we're exposed to. So that's one way in which we really don't have a lot of control over. Some of the other ways that our gut becomes compromised is due to our own evacuation. We take in substances, but we also have to excrete the waste. And a lot of us are living with poor motility, poor gut motility. You have heartburn, you have reflux, you have bloating, you have constipation. And that is a wide variety of a spectrum of symptoms that can be associated. And, you may be somebody that, hey, I go to the bathroom every day, so I don't have constipation, but really you're not effectively evacuating your digestive tract. And so that leads to bacterial overgrowth because you're retaining a constant food source, a constant source of waste and other bacteria from the food that we ingest. I tell patients all the time, we have about 30 feet from tip to tail. So from the rooter to the tutor, you're about 30 feet long of tubing, okay? And about 20 to 22 feet of that is all small intestine and colon. Your colon is only about 7 to 8 feet, depending on size. And the rest is small intestine, where so many functions are designed to occur in that area. And so if you do not take in and also get rid of, you will have some you'll have some issues with gut health. So absolutely, constipation is probably the number one thing that affects so many women and leads to a compromised gut health for sure.
Okay, so interesting. And rooter to the tutor.
Yeah, remember that one. From the rooter to the tutor.
Yeah. And you guys have heard me talk about this. I've had compromised gut health at certain times through the past several years. It usually seems to happen after having a baby, going through that pretty traumatic event of labor and delivery. After having Cole, I had leaky gut, which I didn't even know. And I got strep 5 times that winter, ended up being on antibiotics for 61 days, wasn't smart enough to know I needed to repair my gut, heal my gut. Cole was on antibiotics because he got a fever at 7 weeks old. And in Ohio, if a baby has a fever, they automatically do a spinal tap and put them on antibiotics without even thinking or using their brain to know that it's actually just a cold that he had and was causing the fever. So he had compromised gut health, got sick so many times that first year. Was just awful, terrible. So let's transition to a conversation about bloating, because so many of us struggle with bloating. And although many women come through the foster way and experience a big improvement with the bloating, many through VIP incorporate some different things again and start to feel that bloating again. So talk with me a little bit about what causes bloating.
Okay, so bloating, and I will tell you honestly, in my practice, I tell patients this: bloating is the number one most difficult symptom to resolve because it's multifactorial, and especially for women because we have other issues as well, stress, hormone involvement. Women are much more greatly affected by bloating than men, which really is another reason that I really have a passion for women. But bloating, there are 2 primary causes. The number one primary cause is poor evacuation. You maybe have bowel movements, but you're not fully evacuating your bowel very well. You go to the bathroom and you're like, that wasn't very satisfactory. Or maybe you have to sit for a very long time on the toilet. Maybe you're in the bathroom for an extended period of time attempting to evacuate, or maybe you have to wipe excessively. Who's been there? I mean, how many, you go through a roll of toilet paper and you're like, honest to God, I'm just going to get in the shower. This is ridiculous. We all do that. Are you going to get the garden hose? My God, I can't take it. You know? And I have, this is a real issue, y'all. I know I'm being silly, but I talk about these things like every day of my life. So forgive me if I'm callous, but I do this all the time. But, you know, wiping, or not evacuating, and then just not having the sensation of evacuation. And so that leads to this retention of waste, which is full of bacteria. And it's also food for the fodder, food for the bacteria that live in our gut. And so they begin to replicate at a rapid rate. So you kind of have this gut orgy thing situation going on where you have all this bacterial food, and the bacteria in your digestive tract is just like, yes, and it starts to replicate rapidly. When bacteria replicates in an anaerobic environment like our gut, no oxygen, you will have methane and sulfate gas production as a result. Methane and sulfate gases, especially methane and hydrogen gases. Methane gases typically have sulfur smell to it. So you may have had bowel movements or gas, and you're like, oh my God, who opened some eggs? You know, and that is your body replicating gases due to bacteria. Gases expand and they rise, and they typically will rise to the very top of your digestive tract, which is your transverse colon here. And that's going to put a lot of pressure on your upper digestive tract. So you often will have more bloating of your upper digestive tract, leading to reflux, leading to belching, leading to heartburn, all of those things. So evacuation, again, that 30 feet of tubing has to be there if you're going to, number one, try to get rid of bloating. And I can go over methods as well, natural methods with that as well, things that I would recommend without knowing you personally or knowing your situation personally. There's a lot of things that we can do to try to improve that. The second most common cause of bloating is a malabsorption of carbohydrates. Carbohydrates have to be broken down in your small intestine. If there are carbohydrates that you're consuming that are not well digested by the small intestine, they will spill over into the large intestine. And at that point, the gut bacteria, the billions of organisms that live in your colon, will then attempt to digest those malabsorbed absorbed carbohydrates. And that's when you start having that rumbling, that bubble gut, that, oh my gosh, this doesn't feel good. And you start getting really gassy and you're farting all over your house. And that's when that happens, is because those carbohydrates were not well digested in your small intestine. They've now entered into the colon, and the bacteria there is just like gobble, 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 and replication is just going crazy. So those are the two most common. And again, there are ways that we can try to modify those carbohydrates through diets. So I'll segue back to you.
Yeah, absolutely. I love intermittent fasting as well, because it gives us that window of time in the morning where we don't feel bloated or gassy in many cases.
Right.
And then we start to introduce food and immediately feel descended if we have the wrong type of food or whatever the case may be. Can you talk with me a little bit about the FODMAP diet in addition to SIBO, however you say that? Talk to me about what is that, who would use it, why would use it, how would use it, all of those things.
Absolutely. So SIBO, or small intestinal bacterial overgrowth, is the number one theory behind what drives irritable bowel syndrome. Over the years, irritable bowel was like this white whale. Oh, it's because you have a nervous stomach. Oh, it's because you're anxious. Oh, it's because you're female. There's so many theories that have gone along the spectrum with irritable bowel, but SIBO, or bacterial overgrowth of the small intestine, is really the number one viable theory at the moment. And that is, again, talking about how microbacteria becomes translocated from the large intestine into the small intestine. And that can be due to a compromised ileocecal valve. If you've ever had gut surgery, if you have poor motility, you do have chronic constipation, the contractions that are, of your bowel that need to go in a forward motion, sometimes go in a backward motion, or you just have reflux of that valve where stool can go backward into the small intestine. And those are a lot of reasons why people can develop bacterial overgrowth. If you're a diabetic, you are very prone to this. You have malabsorption and poor, metabolism of carbohydrates, specifically glucose. And in a high sugar environment, bacteria just grows. So those are a lot of reasons for SIBO. There's a diet called the low FODMAP diet. I made a card in case anybody didn't know what we were saying.
That's awesome.
The low FODMAP diet. And that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And those are all the types of carbohydrates that we know can be difficult to digest in the small intestine, depending on your personal makeup, your personal digestive makeup. And so there are, while we think, hey, I'm having something that's healthy for me, I am eating, kale, I'm having kale, or I'm having Brussels sprouts, or I'm having something that I know is really good for me. It does not mean that those particular types of carbohydrates are able to be digested by your personal gut. Okay. And this is I live the low FODMAP diet. I've done low FODMAP diet forever, and it's very incorporable into what we're doing with the fast weight fat loss, because you don't tell us like what to eat. You're telling us guidelines, and so it's really up to the individual as to what carbohydrates you're putting in your body, whether they are tolerable to you or not tolerable to you. For example, I would be hospitalized if I tried to eat cabbage. I would have like the most horrible cramping. I mean, I'd be at the hospital. My husband would have to roll me to the hospital. Like, so, there are certain carbohydrates which I'm just I just cannot tolerate. And, it's not uncommon. I see a lot in the office where patients will come in, they're like, okay, I've gone on this diet. I'm eating a ton of raw vegetables. I'm doing everything that I know I'm supposed to be doing, but I feel worse. And I'm actually more constipated, and I'm more bloated, and I'm more uncomfortable. Maybe I should just go back to eating processed food and junk because I didn't feel this bad. And that's not the truth. There's an in-between. We can get there. There's a middle ground. And the low FODMAP diet is really the answer. And the methodology is that there are certain carbohydrates that in the digestive tract are broken down to short-chain fatty acids, which are not well absorbed by the small intestine. And then again, they spill over into the large intestine, where that bacteria attempts to break it down, leading to bloating, gas, cramping, diarrhea, urgency, you name it, rumbling, all of those things. So in the low FODMAP diet, there's a specific list, vegetables, the ones to have, one to not have, fruits, the one to have, not to have, those types of things, where you eliminate all of these specific known problematic carbohydrates from your diet. You'll feel amazing. Everybody feels amazing. It's a low anti-inflammatory diet. They're using it for patients with autoimmune illness. It's a wonderful diet. So you'll feel great those 2 weeks that you do this elimination phase. But then you have to go back and you have to challenge your body with these individual categories of carbohydrates, like the polyols or whatever. And if you feel terrible and you have symptoms again, that category is off limits for you. And there may be numerous food groups in that category, like mushrooms and legumes and things like that might all be in one category. So it's challenging. It's challenging when you think about it, but when you go through the low FODMAP diet, you really get a targeted approach onto what your body is able to digest and what it's not.
Absolutely. And what Kendra is referring to is bio-individuality. And one of the main reasons that we do not offer a specific meal plan with the fast way to fat loss is because different people have different preferences, but also different needs. They process food in different ways. She's addressing the FODMAP diet. I know for myself personally, I don't really eat whole grains. I don't feel good when I eat whole grains. So I usually have my carbs in different ways. And so it's really a process and a lot of trial and error once you heal your gut and then go through the process of doing something like a low FODMAP diet if you do or have struggled with bloating and different issues. But it's important to listen to your body and to realize that it's not going to be something that you can solve overnight. And Kendra, you probably agree with that, just working with so many patients long-term. So tell me a little bit more about when we should consider probiotics, how we should consider probiotics. I know on the last call that we did with Ali Dameron, you were kind of chiming in via the chat feature and talking a little bit about gut health and probiotics and different things. So talk with us more about probiotics specifically.
Okay, so probiotics are fabulous. A lot of people are familiar with probiotics. We're bombarded with marketing regarding probiotics. And the concept behind probiotics is that they're good, natural, known micro bacterias that we know our gut needs, and we can replenish our gut with those microbacterias, which will help us again with digestion and help us with bloating and help us to break down foods easier. So probiotics are definitely known to be beneficial. There's tons of research right now going on as far as like what type of probiotic for individual people with individual problems. I really want to caution you guys to stay away from the prebiotics. Prebiotics are a big push right now. Now, if you're a normal, functioning, healthy person, you don't have a bloat, you don't fart, you poop every day. I mean, everything is just grand in your life. You could probably tolerate prebiotics. And the concept is that the prebiotics feed the gut bacteria and help it proliferate. So in theory, you take in prebiotics, you're kind of growing your garden. You're growing your garden. It's helping you have a better microbiome, but a lot of us have compromised guts. So you take in prebiotics and you're growing the wrong bacteria, which lead to more bloating, more indigestion, more cramping, more diarrhea. So unless you have just like a perfect situation with your digestive tract, I strongly recommend staying away from prebiotics and do probiotics. And probiotics can be a natural source like kimchi, sauerkraut, kefir, fermented foods, and that's totally fine. But it can also be packaged and processed capsule form probiotic. There's no medical guideline as to which brand or how many billion organisms or which organisms are necessarily beneficial. But in gastroenterology, all of the major think tanks, like the American Society of Gastroenterology and the American College of Gastroenterology, specifically recommend blends, multiple strains. Specifically lactobacillus, bifidobacterium, and then a fungus, which is also called Saccharomyces bulgari. And those three are the top known strains of bacteria and fungus, which we know actually can benefit our gut. So as long as you have a blend and you have more than just one organism, typically you'll tolerate it. But if you try a probiotic and you have worse symptoms with it, move on to the next one. Not all probiotics are created equal, and it doesn't mean that you won't tolerate the next one. So don't be hesitant to try a different one if you had a bad experience in the past, for sure.
I'd like to share an experience that I'm having right now and kind of going through and then get your insight on it. And I think this will be helpful for our ladies. And again, I feel like I'm always just like sacrificing my body for the sake of like our VIP group and my family. And like, let me just get everything, have all the problems. And then I can. So right now I'm having an issue where I have a rash on my midsection. This is TMI and it's like awful and gross and whatever. And it's like, it gets worse, it gets better, whatever. So right now, what I have done is I'm like, you know what, I'm going to go off of probiotics because I don't want to feed any bacteria happening until I figure out what the issue is. So I just ordered an organic acids test and a food sensitivity test. I'm going to do it's like stool testing and then get some insight on what's going on in my gut before I make decisions about what probiotic to use. Because what I don't want to do is just add something when I'm not sure what the root issue is. So what is your insight on that? And then also, what are your top tips for improving gut health moving forward for those of us who know we clearly have an issue?
Yeah, for sure. No, I definitely think if you have something going on, a rash, a cold that won't get better, sore throat that won't get better. If you have these things that are going on, you really do want to consult a professional and eliminate unnecessary things, whether that be your supplements, probiotics, sprays, perfumes, things that we're taking in. And I do want to also kind of throw this out because I am a hepatology nurse practitioner as well. So I treat a ton of liver, a ton of autoimmune liver disease, and fatty liver disease by far is the most biggest thing I treat. But, which the Faster Way to Fat Loss is just such a wonderful program for fatty liver disease. And I constantly refer people, but your liver has to metabolize. It actually has to filter everything that you take into your mouth. Everything, whether that be a supplement that's organic or natural or a food substance or alcohol or whatever, your liver literally takes the first punch in that breaking down of those substances. So, if it's something you're taking because you saw an ad on Facebook or you're taking because somebody is selling a product through another weight loss program that I won't mention, don't just take it because so-and-so said it was okay. Look into it, do your research. Supplements are wonderful. Natural supplements are fantastic. Medicine is based on organic substances, plant life. That is how we have modern medicine, is from organic things. But you just have to be careful of what you're putting into your body. And if it's not something that, is necessary and you're dealing with any, like a rash or something going on, you should eliminate all unnecessary things until you know more in depth of what may be causing it. Because you're going to have conflicting variables. Like, well, maybe it was this, well, maybe it was that. I tried this is new, and I do that all the time because I'm trying new stuff. I want to be as healthy as possible too. So, I have to tell this to myself, like, okay, stop with all the, stop and, just bring it down to like a more manageable level of things that you're ingesting or putting on your body, for sure.
Yeah, absolutely. And then for those of us who are aware that we have compromised gut health, what are your top tips for healing our gut now?
Top tips. Okay. So, question your motility, question your regularity. Look at it, like I mentioned, when you have bowel movements, what is the volume like? Do you feel like you're evacuating? Are you having to wipe a lot? Do you feel like there's more, do you feel like you need to go more? And if you do feel like that, you may have a motility issue. And I'm certainly happy to help and answer any questions that you ladies have for sure, and try to steer you in the right direction. And in our practice, we kind of pride ourselves on being more functional medicine and more functional GI medicine. So we use a ton of natural methods to help with evacuation. And one thing I would really encourage you all is to look into visceral massage. Your viscera is your abdomen and the organs in your abdomen. And we can have restrictions of those muscles, including our digestive tract, due to adhesions. If any of you ladies have had surgery, gallbladder, hysterectomy, C-section, tubal ligations, any kind of abdominal surgery, you can be prone to more connective tissue adhesions that may be affecting your bowel's motility. We're doing a ton of ab work. We're doing a ton of exercise. If you're new to exercise, you may not be relaxing those muscles appropriately and may have restriction of your digestive organs as a result. So there's really no wrong or right way to do visceral massage as long as you do it right to left. The left side is your exit, right? Everything is coming out through your rectum from the descending colon on your left. So as long as you do massage from right to left, there's no wrong or right way to do it. And there's so many YouTube videos, and I will refer patients to YouTube all the time to look up visceral massage for constipation or visceral massage for bloating. And you wouldn't believe how much benefit just actually manipulating your own digestive tract through manual compression and massage will actually make a huge, huge difference. So that is really one big tip. Again, if you're not evacuating, everybody's heard, I need to increase my fiber. I need more fiber. Okay, well, there's so many options with fiber. Where does one go? What fiber? There's soluble and insoluble fiber. Insoluble fiber is very poorly digested. It's very poorly used by your digestive tract. And in fact, it'll probably make you more bloated. So having a big head of iceberg lettuce is not going to help you. Like having, a bunch of, just buying chicory root or inulin because they're natural fibers, they're not going to help you because they're insoluble. They do not break down in water. They do not break down your digestive tract, and they just may become an irritant. So I would strongly encourage psyllium husk fiber. Psyllium husk, that's spelled with a P-S-Y. That's all I can tell you right now off the top of my head. Psyllium husk. I'm not a good speller. Psyllium husk fiber, that's actually the root fiber in most natural fiber supplements that you may see at Whole Foods. Even Metamucil, which is a national brand, is made from psyllium husk fiber. But I would encourage you to find an all-natural, totally gluten-free, totally process-free psyllium husk fiber and incorporate that into your daily routine. Psyllium is what we call an adaptive fiber. So whether you're constipated or you have loose stools, it's able to adapt to what you need, whether that be bulking your stool or helping your stool to be more well-formed but not hard. Psyllium is actually able to do that. And so I use a brand called Konsyl, K-O-N-S-Y-L. It's a nationally recognized brand. It's obscure, but nationally recognized. And it's totally gluten-free, totally preservative-free, and high concentration of psyllium. And I really encourage you to maybe incorporate that into your health regimen because that can certainly help you with evacuation and help you with motility for sure.
And really quick note, Fiber One bars or other protein bars that are high in fiber are not the answer. So many clients say, Amanda, I'm bloated, I'm gassy, I'm this, I'm that. I'm trying to get in my carbs. I'm trying to get my fiber. So I had a Fiber One bar. I had this type of bar. Or that. You're setting yourself up for disaster and a lot of discomfort when you grab those bars.
Those are garbage. That's junk fiber. They put the most ridiculous, they put chicory root in there, which, as I mentioned, inulin is another term for that. It's a cheap cardboard fiber, and they get away with calling it a fiber, but it's insoluble, and it will give you the worst GI symptoms ever. Fiber One is like, they should be sued. It's terrible. It's a terrible, terrible company. 100%. Also, be careful with your sugar alcohols, ladies, because I know, Amanda, you've been really pushing, like, don't go down the gluten-free aisle. Don't be just getting substitutes for some of the junk that we eat anyway. I couldn't agree more. Could not agree more. When you buy something that's packaged, if it has more than 5 ingredients and you don't know how to pronounce 8 of them, don't buy it. Don't buy it. It's a chemical. It's a GMO. It's a processed, fake it's not a nutrient. I mean, if you don't know, if there's more than 5 ingredients and you can't spell them, it's just, or, just forget it. It's garbage. And sugar alcohols are such a problem. And I'm talking about high fructose corn syrup, mannitol, sorbitol, poorly digested short chain fatty acid carbohydrates that will absolutely tear you to bits. Okay. And so, mannitol and sorbitol can be naturally found in some stone fruits like peaches and cherries. And that's why if you eat a lot of stone fruit, you can have diarrhea and cramping and stuff like that. But way better to eat a peach than go get some fake sugar alcohol. Even chewing gum has sugar alcohols in it, which can cause you to have some GI upset. So read your labels, guys. Read them. And if it's not made with whole ingredients and you don't know how to spell it, just don't eat it.
Agreed. And I literally could listen to you all day and pick your brain on behalf of the VIP clients all day, but we do have to hop off. So let's go ahead and do this. Let's pop this recording up onto the VIP page. You're in that VIP page, Kendra, and you even said like, hey, if anyone has questions, I'd be happy to answer them, which was so generous. So what we'll do is, ladies, if you have additional questions, feel free to post those on this particular thread that I put in the VIP page. Kendra, you are such a wealth of knowledge. You're a smarty pants, and we really appreciate you and the time that you took. And I can feel your passion for the ladies in the Faster Way to Fat Loss. And again, we just really appreciate the deep dive. So thank you.
Thank you so
and
much.
We will see you later on the page. And I hope you guys all have a great rest of your day. Bye, everyone. See ya.